Hi, this is Tiffany with Watch Song Medical Cannabis Education for Healthy Living. And today I just got to talk to you about this very consistent pattern I have seen with the clients I work with. And in particular, I'm talking about those that come to me with wanting to get off of pharmaceuticals to treat their depression and anxiety, as well as in general treat their anxiety and depression. And the pattern that I have noticed is that people have various levels of success treating depression and anxiety. And the kicker with it is how they are approaching their medical cannabis therapy with trying to treat these symptoms. So what I mean by that is, are they coming into it thinking that cannabis is going to fix them, cannabis is going to cure them? Or are they being more realistic and thinking that they are going to substitute a man-made pharmaceutical chemical for a plant-based, more natural medicine? Okay, when people are very clear that, oh yeah, I know I'm not treating the source of my depression, I'm just trying to get off of antidepressants to get off of the pharmaceutical game and the physical dependency on those antidepressants, people are much more satisfied with the results because there's no disillusionment that what they're actually getting out of that. They know they're not treating and curing the source of the anxiety or the depression. They can just be happy knowing that they got off of antidepressants. So what's the other side of that? So the client that comes in thinking that medical cannabis is going to cure or fix the source of their depression or their anxiety. And I want to be clear to say that there are lots of physical things that can happen in our bodies that cause us anxiety and depression, and cannabis can help with those things. So for instance, if it's somebody that say has a tremendous amount of pain, and the pain is really the source of their anxiety and depression, well, cannabis can absolutely help with alleviating that pain, which then in turn can alleviate the symptoms of depression and anxiety. So you are treating the source with that. However, more commonly, what I see happen with people is that they come in and they think cannabis is going to cure or fix the source of their depression, and they're disillusioned in a way because the source of their depression is related to things that cannabis, in my opinion, in my experience, doesn't fix. Okay, so for instance, I'll use myself as an example. Several years ago, I felt bad about the way that I looked and I felt. I've weighed 70 pounds more than what I do today. I didn't like that extra baggage. It didn't make me feel good. I felt sluggish. I didn't feel good about myself. When I started using cannabis did not fix that perception issue that I had with myself. But what cannabis did was, for me, it helped alleviate the back pain and the pelvic pain that I was having. I was able to get more active, and then through that, I wanted to eat healthier, and then I lost weight. Okay? So what are the other things that it does not work for? Medical cannabis does not cure the source of. If look at the things that you're doing in life, all right? Are you in a job that you absolutely hate and despise? All right? Is that the cause of your anxiety or depression? That's a big one. And people think that they're stuck in those things, that they have to do things that they hate. And that's not true. Don't do things that you hate in life. It's going to make you depressed and give you anxiety, folks. Walk away from those things. Get in touch with your heart. What feeds your heart? What feeds your soul? You've got to nourish yourself. All right? That's the way that you treat anxiety and depression for those things, is that you've got to nourish your soul. You've got to allow yourself to feel and get in touch with those things. Stop distracting from the world. Okay, get your head out of a computer, get in nature, get in joy, get in touch with what feeds your soul. If you've got past traumas, of course, use your discretion and always work with a professional as needed. But I can tell you, for my past traumas, medical cannabis didn't do a darn thing. Okay, it didn't fix or cure any of that. I had to do deep inner child, deep shadow work to really fix the source of that depression and anxiety that I was feeling that was created by those past traumas. So the bottom line here, the big takeaway is that the secret to really getting effective relief with using medical cannabis for anxiety and depression is that you've got to use medical cannabis as a tool. It's not a cure, it's not a fix-all. You can absolutely use it as a tool in conjunction with doing other work that is really going to get at the source of what's causing your anxiety and depression. So medical cannabis, more than anything that I see, is a tool for anxiety and depression. It's not to say that you can't get there. You absolutely can. I got there. I see other clients get there with treating the source of their anxiety and depression, but using medical cannabis as a tool and not being disillusioned that medical cannabis is going to actually fix your depression or anxiety. You can get there, you can do it, but you've got to use it in conjunction with other ways to nourish your soul and feed yourself and treat the true issue, which is that there's something in your heart that needs fixing. We've got to fix our hearts, all right? So thank you for watching. I sure enjoyed sharing this information with you, and you can check out my website at www.watchsong.net, and also events that I have going on, training events on Facebook. That's all. I can also be found at watchsong.net there as well. All right, thanks folks. Take care.